Well, next tonight, the latest in our series of reports on the growing epidemic of child obesity, with nearly a third of British youngsters aged between 2 and 15 now overweight.
The problem is particularly worrying among children who have special educational needs, where that obesity figure currently stands at more than 40%.
Well, charities say this could have disastrous implications for their future health, but that the government simply isn't doing enough to tackle the problem.
Well, our reporter Adam Fowler has been with one group in Sheffield on the front line of the health battle, taking action on obesity.
On your marks, get set, go!
9 young people with learning disabilities have been coming to these fitness sessions in Sheffield for the last 6 months. It's part of a unique course aimed at reducing levels of obesity in children with complex needs.
I kind of like the basketball.
It's a really good way to help people to understand what you have to actually eat.
We're working together as a team and not being separated.
You've lost a lot of weight, haven't you?
Yeah.
Was it easy or was it hard?
Easy peasy.
41% of children with complex needs are obese, compared with the usual 33%. This can lead to health problems including type 2 diabetes, fatty liver disease and high blood pressure. It's a problem that the Shine Health Academy says is getting worse, forcing them to help younger and younger children.
Diabetes was only ever known as a middle-aged disorder, and now we've got 6-year-olds with type 2 diabetes, fatty liver, high blood pressure, and I think that is not recognised within society.
We've got 250 this time.
Children taking part in the course exercise their minds as well as their bodies. They learn about healthy eating, nutrition, portion sizes and how to make healthy choices, while their progress is charted week to week. And it's not just the children learning.
And portion size, that were a big thing for me.
In a separate room, the children's parents are learning too.
It really helps to have the parents talk to each other, so we don't feel alone. So we're not feeling as if it's our fault because they've gained weight. You get talking, you think, well, actually, they've got a condition that adds to the weight gain, and sometimes it is beyond our control.
The scheme's believed to be the only one of its kind in the UK. The charity that runs it says there's a desperate need for the government to focus on reducing obesity in children with learning difficulties.
There needs more funding available to treat children with learning disabilities who have problems with obesity, as well as prevention. And until that happens, then these children won't get the support they need.
We need the government to take responsibility. We need them to give specific guidelines for what services for complex need children should look like. They should fund it. They fund adult services with complex needs. Why not children? Why are they a forgotten breed?
It's the end of the 6-month course. All 9 children on the scheme have lost weight and learned how to keep it off. 10 more families are already waiting to find out if it'll be put on again in September and how they too can live happier, healthier lives. Adam Fowler, ITV News, Sheffield.
Well, in a statement, the Department of Health said we know overweight children are more likely to become overweight adults, which is why our world-leading childhood obesity plan is cutting sugar and calories in food before it hits the shelves and plates, taxing sugary drinks and helping children to exercise more. It added, we're in the process of working up an updated plan and will be in a position to say more shortly.
Well, a little earlier I spoke to Diana Johnson, the Hull North MP, who sits on the Health Select Committee. I began by asking her just how bad the problem is.
Well, we know that 1 in 3 of our youngsters is overweight. We know that in disadvantaged areas that's higher, and I'm certainly aware amongst groups of children and young people who have special needs or have disabilities, often the rates of being overweight or even obese are high as well. So I think we all recognise across the piece that there is a problem, and we need to do whatever we can to help families and children and young people tackle this problem.
Well, in our report, we heard charities saying there's simply not enough support from the government for these vulnerable youngsters. Do you think that is a fair assessment?
I think that's probably a very fair assessment, and you know, there's been a lot of talk recently about making sure that, for example, mental health is given the same parity as physical health, but actually some of the issues around what we eat and the kind of food that we feed to young people, that's always kind of been pushed to the side. And I think we all know that good nutrition and having a healthy body weight is important for young people's health just as much as for adults' health, and we need to do more to help families do that and to make it easy to do that.
Now, you are on the Health Select Committee, and so you do have a fair bit of influence on the issue. What are you going to do about it?
Well, the Health Select Committee has recently produced a report on childhood obesity with a whole range of recommendations that we hope the government will take up, including things like having a ban on junk food advertising up to 9 p.m. on TV, because we know that children are often watching TV programmes on a Saturday night. You know, they watch all the ITV and programmes that are on, the talent programmes, to stop that. We also think that the sugary drinks levy has been successful by making manufacturers reformulate their drinks and the amount of sugar that's in their drinks. So we'd like to see further regulation to make manufacturers reformulate high fat, high sugar, high salt foods. We also think it has to be a whole system approach. That means that government across all departments and in the NHS and in schools is working together to make the healthy choice, the easy choice for children, young people and families in general.
OK, Diana, lots of work to be done, but we're going to have to leave it there. Thank you for joining us.
Thank you.